Hi. So, continuing with our discussions on disability and sexuality, let us today talk about sexual health of people with intellectual disabilities. Some people with intellectual disability, such as men and women with Down syndrome, they have low fertility rates, but many others are as fertile as anyone else. Many people with intellectual disability want to have children, but their own family members or carers may oppose this, making it difficult for couples to plan for pregnancy and parenting and to access the necessary services for themselves and their baby. Many people with intellectual disabilities can be loving partners, parents. They can maintain strong relationships and they can care for their child. Parents with intellectual disability usually need additional support, as do many other groups in our community, such as parents who are very young or who are experiencing mental health issues. Why shouldn't we let them be parents? People with intellectual disability should have the same choice regarding preventive health measures for sexually transmitted infections and other conditions as people without disabilities. This should include knowledge about condoms and telling them condoms can be used to prevent sexually transmitted infections. The person with disability may need to be provided with appropriate and accurate education about STIs and condoms, including the opportunity to practice how to put condoms on correctly. Nearly all women with intellectual disability can learn menstrual hygiene, just like any other woman. A woman's menstrual cycle should not be suppressed just because of her intellectual disability. Women who are or have been sexually active should have a regular pap test to prevent cervical cancer. This is a must. This should not be ignored or neglected. People with disabilities should participate in immunization programs, including human papillomavirus (HPV) vaccine and immunization programs, which helps prevent cervical cancer. Women need to understand the importance of being aware of how their breasts normally look and feel and should be encouraged to see a doctor if they notice anything unusual. They should be taught that, they should practice that. Women aged over 50 years need to consider having mammogram for the early detection of breast cancer. A doctor can provide more information on this, but it needs to be like in an easy and understandable format. Men need to understand the importance of seeing a doctor if they notice a lump or anything unusual with their testicles. So, when providing health services to people with intellectual disability, doctors and other healthcare professionals need to take into account the particular disability and circumstances of their client. For example, some women with intellectual disability can find a gynecological examination or procedures such as pap test overwhelming, and they should be made to understand all these procedures in an easy format. The carers of person with intellectual disability can help by modeling assertive behaviors, making referrals if possible, making referrals if the person needs further training or support, and explaining the basics of protective behaviors. All this can include that every person has right to say what happens to their body. Everyone has right to feel safe. There are laws that protect a person's right to live safely without being harmed or exploited. There are many people who can be trusted, but also some who cannot be trusted. So people with intellectual disabilities must be made to understand all this. Or some types of behaviors are appropriate for yourself and others, but sometimes of but some types of behaviors are not. Or you can communicate assertively and say no to unwanted behavior. It is okay to change your mind about sexual behavior or activity even if you have already agreed to do something. There are people who can help you if you are being abused or exploited in any ways. So the parents and caregivers can make the person with intellectual disability understand this. And they should be able to understand what is safe for them or what is not safe for them.